everyone. Today's session is about the COVID-19 vaccine and how we would like to end the pandemic with those vaccines if possible, and information that we need to know to be prepared and aware of what's going on with the pandemic and with this virus. So today's speaker, we are very honored and happy to have Dr. Nasima Begum. She's an infectious disease specialist at Foothill Infectious Disease Medical Group. She did her residency and fellowship in infectious disease from the University of Southern California, LA County Medical Center, in private practice with Foothill Infectious Disease since 1998. She's also the chair of antibiotic stewardship program at Emirate Health Medical Center, and she is the past chair of Infection Control Committee at Citrus Valley Medical Center. So without further ado, let's welcome Dr. Nasima Begum. Thank you so much for being here today and spending your valuable time with our Olivers. It's an honor to have you with us.
Hello, good morning. Assalamu alaikum, everybody. I'm really privileged to join all you beautiful audiences today. And this is a very, very timely seminar. So I'd like to thank Janab for arranging that. She's a wonderful, dynamic lady. She approached me last month and I said yes. And I did not realize at that time, things will be changed so rapidly. So within the last 8 weeks, we are into a fourth surge. History. Do you know, all of you, I'm asking a question. If we unveil the previous outbreak, remember the Spanish flu, 1918? And all other infectious disease, the flu pandemic, 1918, 1919. We have great lessons from those outbreaks. We have great guidelines. Are we following? You know, the previous pandemics, usually pandemics come every 100 years. We did not have the privilege of prevention. Millions of people died. So today, definitely, what is my message to all of you? I am going to promote the preventive part of it. We all know about it, but let's talk about it together. Any burning questions you have in your heart, your mind, just throw it to me. With my little knowledge, I'll try to do it because I'm not a researcher, scientist. I am following their guidelines also as a practitioner. Already, I took care of almost 1,000 patients, more than 1,000 patients since the beginning of last year, the outbreak of pandemic. We are all tired and exhausted, but we are still striving because there's a light. End of the tunnel, there's a light. So, you know, let's talk about the light, how to get to the right path to end this pandemic. So I had some slides that I can share. Maybe that'll be boring, but let's get to the boring part first. Then we all can exchange our ideas and questions, if you like to do so. So let me see a few of the slides.
And while Dr. Begum is getting the slides started up for you, please feel free to share any questions in the chat, and we would be happy to include them during the presentation if they're relevant to the topic being shared. So go ahead, Dr. Begum. We are unable to see your screen if you were trying to share. Let's see. I think you might have to do the process again. So click share screen.
Let me see this. Actually, I was just playing the screen. Let's try this. Do you see it or no?
No, we do not. We see you.
Okay. Let me end and restart.
Yes, that's the way to go, always.
Okay, I wanted to go fast. That's why I guess it happened.
Yes, now we see your desktop.
Can you see it now?
Can you take us to your first slide?
Yeah.
Perfect.
So is it working now? Well,
Yes, we see it.
so let's talk about some of the timeline. I mean, this is not up to date timeline. December 19, I came back from a health campaign. I went for a Rohingya camp. December 31st, I landed to California, LAX in January. Did not realize that I'm flying over some of the countries where this SARS-CoV-2 is like, causing this problem, outbreak happening. I reached here in January. Suddenly I hear noise here and there. Some people are like clusters of flu, this and that. It took a long time for WHO and CDC to realize that we are getting into this huge pandemic. But everybody was late. Even March 11, finally, WHO declared that COVID-19 is a pandemic. COVID-19 is the name of the disease. It's caused by SARS-CoV-2. Yes, we have seen this kind of virus before. This is not influenza or flu that causes flu. This is a different coronavirus. It causes common cold. So it took a long time for the leaders, the world leaders, to realize this is a pandemic. So that was March 11, WHO declared. After that, look into my last comment here, January 9, 2021, USA infected 21 million. January 9, 2021. Today, do you know, this month, we have lost more than 644,000 people in USA. We have more than 4 million people infected worldwide. This is worldwide now 34.4 million cases, 34.5 million cases. Death, a lot. So that was that was USA. Globally, 196 million people infected. I remember Spanish flu, death was close to 100 million. With this COVID-19, we have 4.19 million deaths. That is huge, 4.19. This is very important to understand the age. So as we grow, children, adolescents, teenager, adult, elderly, right? We see that the mortality is higher. This blue column on the right side, if somebody's age is more than 90 years old, the mortality could go up to 22%. So I don't want to scare everybody, mortality and death and cases. Let's talk about some good thing, positive thing that will give us some hope. The hope is yes, if we want to end this pandemic, we all have to play a role. It's not about me, it's about us, our community, our family, our vulnerable group, our elderly who has diabetes, high blood pressure, heart disease, asthma, COPD, they are vulnerable group. So we do have vaccines. USA, we are very much privileged to have different kind of very good vaccines. I'm showing how the vaccine work. This is a messenger RNA vaccine. Vaccine hesitance, you know why? Because people thought, well, it takes 8 to 9 or 10 years to make a conventional vaccine. How come people made this vaccine within less than a year? The answer is, this is a totally different platform. I remember as an ID physician, I went to a conference a couple of years back. They were mentioning, hey, we are still waiting for a huge pandemic like the Spanish flu 1918. Almost 100 years passed. We are waiting. It could be this year. So what to do? We have to get ready. How do we get ready? Let's find a way we can make mass production of vaccine. And that unique platform was messenger DNA platform. And this is what we are getting now. It can be produced in a very timely manner in a short period of time, millions of doses. And you know that Pfizer BioNTech has got an order of 200 million doses, because now that we are thinking, datas are coming, the datas are on the other group of the people, which is between age 2 to 12, whether we should vaccinate them. So the trials are going on, data is going to be coming within end of August. So, but the company, NIH, National Institute of Health, already contacting the pharmaceuticals. Hey, make the vaccine because this is safe, this is effective, 98% effective. Let's get it done. Hopefully our kids will be also vaccinated, because without vaccination, we cannot end this pandemic. What is the problem right now? Initially, last year, there was alpha variant. Yes, it was causing disease. We learned that time 80% people will get better by their own immune system. 20% will get sick. Out of that 20%, 5% might lose their life. As this virus is circulating in the community, person to person, it's changing its DNA. Now, right now, this Delta variant, the first case was isolated in India, Maharashtra. So they came to school, they did the DNA sequencing, find out, hey, this is not the alpha variant. We are seeing more of this Delta variant because people are getting very fast they are sick. The initial virus, the alpha variant, it was like 2 weeks of loss of your smell, the symptoms, loss of your smells, not feeling well, a little bit sore throat, a little bit of cough. Then in 10 days, 10 to 14 days, either you go really bad, sick, hospitalized, or you get better. But this Delta variant presenting differently, not giving much time, little bit of fever, sore throat, then their lungs are involved. They are going into respiratory failure. Now, almost 20%, more than 20%. So let me go back to June. In June in USA, there are only 2% cases, they were confirmed Delta variant. This is July. It's more than half of the patients are now Delta variant. So this is alarming, because the vaccinated people are safe. Vaccinated people has enough antibody. Even if you expose yourself from a Delta variant, from somebody who's talking to you without a mask, give the virus to you, or somebody travel overseas, came to your home and might be carrying the variant on your nose, and they can give it to you. But as you are vaccinated, your body will fight that. You'll not get the disease, but you can give it to other people. And that's why the new mandate is what? July 17, the new mandate in LA is that you got to wear the mask if you go indoor, regardless of your vaccination status. If you got vaccinated fully, you got to wear the mask, because we have to save the people who are not vaccinated yet. In LA County, almost 4 million people has not received the vaccine yet. Yeah, surprise, huge number. Bay Area, San Francisco are doing a lot better than us, because 76% people over there already got 2 vaccines. But in LA, California, Los Angeles, other counties, I think we're still behind. We are still behind. We have to work more. We have to bring the real fact, not the myth that people are getting confused. So you feel at ease to get vaccinated yourself and your family. So yes, Delta variant is the talk of the months. We're all talking about this. This is Delta variant. We are really scared. There is also Delta plus variant. Could be even worse. Why these are worse? We need to understand, when the DNA changes, these viruses attach to our cell strongly, tightly to the binding site, to the domain very strongly. So it causes more damage to our lungs, to our kidneys, to our hearts, to our liver, all the organs. And we could go to multi-system organ failure and death. So, I mean, this slide is telling right now all this hospitalized patient, 97% or more people are unvaccinated. Yesterday I was actually coming out of the hospital, I got a page. So there's this man in ER, his whole family got vaccinated, but grandpa is 95 years old. He doesn't go out. They did not get him vaccine. They thought, well, with the vaccine, he will have body ache. He's 95. He's not going out. Now, what happened? He got COVID-19. He's in ER. The family is crying now. Why did not we give the vaccine to him? Wrong step. He's in the hospital. He's an oxygen. We're giving the full treatment now. The steroid, the antiviral, the plasma, whatever work. We have to try to save this man. So I think I like to share this information. How many people are fully vaccinated? USA, still, we have to go for 100 million people to get vaccinated. Do we have enough vaccine? Yes, we do. But are we taking the privilege to get ourselves vaccinated? We are not. 10 other countries right now at a burning center, including Indonesia, Malaysia, Argentina, Brazil, Peru, Bangladesh, India. I mean, name it. India lost more than 20,000 people from complication of fungal diseases. They lost their eyesight. They became blind. I mean, this COVID is taking a huge toll on all of us. Vaccination. America is donating vaccine. They have a project of 150 million doses to those top 10 countries where people are dying. WHO director is urging Western countries to donate more vaccine. We have this vaccine, so we're not taking it. Sometimes I feel like crying. I get a call from my back home that can you tell your friends, doctor friends here so that I can get a vaccine? Fast track, but no, you cannot get fast track. They have a tier 1, tier 2, tier 3. The vulnerable people will get, and then the adolescents, because they don't have enough. Even they're saying mismatch. If you get Pfizer, get a J&J. If you get AstraZeneca, get so, because whatever work, because we're talking about life. Even if we get with one vaccine, first dose, if you get 20% antibody, that might help you not to get into the full-blown diseases. So what are the age group? Yes, right now, the Pfizer is giving vaccination to 12 and up. So my sister's kids, they got it, 12 years old, but the 9-year-old did not get it. But I heard from NIH and other organizations who are doing the research, safety data, everything thoroughly checked, they will probably open it for age between 2 to 12 soon, hopefully. This is a data, like in J&J, people are not getting much. On the top, you can see Pfizer has given a lot of vaccine, Moderna too. J&J, because they have few case report of some thrombocytopenia and thrombosis, so people are not taking that. Although people who like just one vaccine, they went for J&J. It's still effective. Although the first two are close to 98% effective, this one is close to 70 plus effectiveness. Even that's good, better than nothing. You get 2 shots, Pfizer and Moderna. So there's like 3 weeks gap, 21 days gap between 2 shots of Pfizer and 28 days gap between 2 doses of Moderna. These are, I just talk about it, the age group. Yeah. So vaccine, is the vaccine is safe? When a vaccine is produced, phase 1, phase 2, phase 3 trials. Phase 1, they will do it on probably animal model or very few human. Phase 2, couple of 100 people. Phase 3, thousands of people, 50, 60,000, multi-center, different countries, safety data. After that, with vigorous standard precaution, then it will get emergency uses authorization. And that's what they have done. And we all received it. Yes, we did well. A side effect, adverse reaction, it happened to any vaccines. When our children are born, before they leave the hospital, the neonate, the first shot they got on day 1 of their birth is hepatitis B vaccine. When they grew up by their 2 years old, they have gotten so many vaccines. You know that, right? MMR, all these vaccines that you have to give to children. This is just another addition, and this is addition to end this pandemic. So it is safe, it is effective. There are some cases of adverse effect, but if it happened in one cases of 1 million or 2 million, we have to take that risk because mostly it is safe. And it happened to any other vaccine, even flu vaccine, when we take it, people could get some severe reaction, but that happened in a very low percentage. So with that, I like to tell that, yes, let's get our herd immunity going. So at least we need 85% people get antibody production, either naturally or passively by the vaccination. And you get both, you get the disease and you got the vaccine later on, you even are in a stronger defense mode. Isn't that nice?
Our barbecue enthusiasts. Our passion is barbecue.
Okay, so I think I would just end here. If you have any other question, you could ask me because I have a lot of slides here. I don't think so I have to share all of it. We can make it like a little bit, I can take your questions so that we can just ease our hesitancy here. Thank you.
Dr. Begum, I have some questions that are commonly asked. If you don't mind, I would like to ask them.
Yeah.
All right. Are you going to stop sharing your screen at this point so we can see you? That'll be great. So the first question I had was something you covered already about whether it is safe to take the COVID-19 vaccine. I think you've covered almost all the major points in there. Is there anything else you would like to add when it comes to the safety or hesitancy that wasn't covered in your presentation so far?
You know, the main point here is that the myth are actually confusing people. So my take-home point to all of us is this: please talk to your doctor. And if you don't have access to any doctors, you could always go to the authentic site, CDC, Center for Disease Control, or even WHO, if you like to know what's happening back home, like a global situation. And you could just review. They have enough data. They're revising almost every week. There's something new. So I would say, please do not go to YouTube, Facebook with the unauthentic site which might confuse you more. Talk to a physician will be the best, or who has medical knowledge if you have any medical personnel. Thank you.
All right, that's great advice. If I already had the COVID-19 vaccine and if I had the virus and recovered from it, do I still need to get vaccinated with the vaccine?
So far, the data are telling us when I get disease, COVID-19, the antibody is not very long lasting because they have data came from China, European countries, from the beginning of the first and second surge. It shows that after 8 weeks of recovery, the antibody can slowly drop down. So first we recommended, okay, if you have the disease, wait for 3 months and get vaccinated. So you have enough stronger, long-lasting antibody to protect you. So yes, we should get vaccinated despite our, if we get a COVID-19 disease.
I remember something about you have to wait a few days, right, after getting the virus.
Yeah, initially we did not have enough vaccination, so that time the guideline was, okay, well, wait for 3 months because you're gonna have enough antibody for 12 weeks. But right now they're saying that we have enough vaccines. So even if you recover, you wait for 2 weeks and then you can get the vaccination.
Okay, that's good to know. Do I need to wear a mask and avoid close contact with others if I'm fully vaccinated?
Do you remember the declaration of June 15? Hey, we're going to open up the country. All these things happen. Just less than a month. July 17, things again upside down. So what is the recommendation now? For the public health measure, they're telling us, if you get vaccinated fully, still you have to wear the mask indoor. The reason is that you might be vaccinated and protected yourself. But if you go outdoor and you carry this variant, Delta variant to your nostril, you can bring it home and give it to your children or your family members. So yes, we have to wear the mask now, indoor activities.
It's good to know. Is the current vaccine effective against the new variant?
So there are a lot of knowledge gap, but we have learned a lot. We have came a long way. We know more than what we did not know a few months back. So still we are learning few things. The Delta variant, is this vaccine gonna be effective? So scientists are telling us if you get vaccinated and you get Delta variant illness, it will protect you not to go into the bad disease progression. Like you'll have probably mild symptom because you'll have some antibody that's going to fight this Delta variant. So it might not protect 100% to prevent the disease, even though you get it, but your disease is not going to progress into severe illness, respiratory failure, or even death.
Hmm. And how long does this protection from the COVID-19 vaccine last?
So this is another questions that we are also studying and learning. We started the vaccination process in January of this year, right? This is July. So I received my vaccine in January. How long is going to be lasting? We are thinking from our previous knowledge when we had coronavirus disease in the past, that antibody was in the body for almost a year, more than a year. With SARS-CoV-2, we are thinking that we might have more than 1 year. It could be lifelong. It could be a very long process of protection. But we do not have the proper answer yet because studies are going on with these questions that how long it will be protecting us.
Hmm. There's some questions coming up in the chat by our Olivers. One question is why mortality rate during the Spanish flu was so high compared to COVID-19, 50 million versus 5 million.
You know, this was a question that I always had in my mind. So 1997, when I was doing my fellowship at USC, so this one of my attending, very good, he told me, Nasima, in your lifetime, you're gonna see one pandemic. So ever since then, every year the flu come, I think this is gonna be the pandemic. I have to get prepared. I have to promote the vaccination to my family, friends, community, right? But who knew that this is gonna be this coronavirus? Nobody knew, right?
Mm.
So what was your question, Janab?
It was how come there was such a big difference in the mortality rate, 50 million versus 5 million?
Right. So I asked him the questions. Do you know the World War was going on at that time? And the death at that time was, my attending's answer, I'm just reflecting, remembering and telling, sharing with all of you. That time it was World War, right? The soldiers were out in the field. They were getting this Spanish flu. The death at that time was mostly younger generation. Here now it's mostly older generation, right? A lot of elderly we have lost from this COVID-19. That time we did not have antibody. You know, when the penicillin was invented, right? So this was 1917, there's no antibody. So people got influenza, then they got secondary bacterial infection, pneumonia. There was no antibiotics. So people died from bacterial secondary infection. Number two, they took a lot of aspirin. So that aspirin causes toxicity and people died. So those are the three things. And the third thing is that no vaccination was available. So those three main causes. Right now, all this COVID patient that we're admitting, we are actually giving them antibiotic even from day one, like when they're hospitalized, because they have symptoms at home. So they are getting COVID-19 disease and then secondary bacterial infection. We have so many antibiotics now that we are so lucky compared to that time and this time. So those are the three reasons. So many.
Mm-hmm. And then the next question we have is, are the symptoms of COVID any different with the Delta variant?
Yeah, you know, I mean, so the Delta variant, first case was in India, Maharashtra. So those doctors, they're thinking, what's happening? I mean, these patients came to ER with fever, sore throat for 1 or 2 days. We are doing this high resolution CAT scan. They have 50% lung involved, 25% lung involved. So this is causing very direct deep into the lungs very fast because it attached to the lung, the ACE receptor. You know, this COVID virus has this spike protein, and they attach to a receptor called ACE receptor to our tissues. So that ACE receptors are abundant in our lungs. So the Delta variant is going to the lungs, attached very tightly and causing lung diseases and pneumonia faster than the Alpha variant or the initial B117. Right now, this is like B16172. That's the name of the DNA sequencing. So yes, this is going directly lungs. Before we knew loss of smell, fever, body ache, the upper respiratory tract infection type of symptom. But no, this is bypassing all those, going directly to the lung.
Mm-hmm. And then the other question that we have here is, I understand UK will be giving booster shots in September. How come they don't wish to do that here?
Well, they are wishing to do that here. I just got the email today, early this morning, that they are already talking about giving a booster dose to the vulnerable group because definitely study going on, data are almost ready for the younger people, like 2 to 12. So that is one category. And the third category is that the booster. So we might start boost end of August in USA too.
Mm. Okay. And in the middle of all that, we'll see the pop-up of the flu vaccine, I'm guessing too, right? Because flu season starts around September too.
Last season, like this November, December, flu season is from October to May, right? Mm-hmm. I personally saw only one influenza B patient. Only one. You know why? Because everybody's masking, right? Because right. Influenza is also spread by droplet from your respiratory secretions, right? So everybody's masked up. So you don't see that many influenza.
That's true. I noticed that too. I've been discussing that with my family, how the mask has protected us from other illnesses that would spread otherwise. But there's an interesting question here, which I have experienced myself in my family. This is from Helen, and she said, I've noticed now that the common cold has exploded among my family now. And this is the case with my family too. I'm currently sick with a head cold. The COVID vaccine doesn't protect against the cold. And why?
So what causes common cold? There are thousands of viruses that causes common cold. See, even this coronavirus, this COVID-19 disease is caused by coronavirus family, which we named SARS-CoV-2. So this coronavirus is a well-known virus, many years to cause common cold, runny nose, sore throat, headache, sinusitis. There are other viruses like adenoviruses, rhinoviruses. These are all caused, these causes upper respiratory tract infection, bronchitis, usually upper common cold. So, so that's the reason. Number two is that how to protect, you got to boost up your immune system. So what are the things that can boost up your immune system? Hydration, vitamin C, a lot of limes and anything that has vitamin C, or you can take vitamin C tablet too. All COVID patients, they are hospitalized. We are giving 1,000 milligram of vitamin C that helps the boost up the immune system. All of us, all these ladies here, do you know your vitamin D level? In America, it's very common to have vitamin D deficiency. A lot of time we put the sunscreen and then we are covered up. We don't go to the outdoor much. We work indoor many hours. So we all have vitamin D deficiency. Vitamin D is a well-known factor to boost up your immune system. So you all need to know what is your vitamin D level. It should be more than 30. Normal level is 30 to 100. So you need to check with the doctor. Hey, can you check my vitamin D level? If low, please give me vitamin D. And take a lot of food that has vitamin D, milk.
And then we have another interesting question from Nicole. I love it. How come they don't make it mandatory for everyone to get the COVID vaccine, given the huge impact it has on the entire world, global economy, and health of people?
Okay, Nicole, let's give a high five to you. Give it to me. Yes. Go hand to hand talk and let's go to White House. Why they're not doing it? I'm so mad. Just like you, you're my buddy. So why they're not making it mandate? I mean, we have too much freedom, right? I mean, we cannot just like in all this, like lawyers are ready, right? So even the government official need to work very, cautiously. So although this pandemic, we are losing all this life, people are still working on it. But California, I think I have to check my email. I got another email. Every morning I get up and all this tweet and everything comes with a new update. So I think they're talking about mandating it to the healthcare worker, because there's certain percentage of nurses and doctors and who are in medical field, they are a vaccine hesitant group. So they might make it mandate to get vaccinated. So this is like a California governor is working real hard. So I think it will be also in Nevada and Arkansas, because these are like a highly fired up right now with COVID surge. This is like a fourth surge going on, right? I was thinking that we're gonna see a fall surge, but look at it. We're already seeing a summer surge. But Nicole, let's go. Let's ride it up to the White House. And we got to, every voice counts. We
Right.
have to use
Thank
our
you.
And I was listening to news reports about even the federal employees being mandated for getting the vaccine. So yeah, I think
It's coming. It's coming.
it's just a lobby of people that are, anti-vaccine, that, might be the pushing force against that. Now, there's a question here about, can drinking lots of hot tea help to make the virus leave your system? If a person gets some symptoms such as a sore throat and suspects they might have the virus. So little things that we can do
Yeah, that.
with these symptoms and the vaccine, the virus.
Yeah. So the old-fashioned way, I
Mhm.
always love that. We practice medicine here. We talk about medicine, right? But what are the prevention? What are the natural remedy that we can use? Even I myself, when I was going to all this COVID patients' room, seeing them coming home, my stove was on with hot water, with all this kind of spice, like, cinnamon and everything, green teas, and like the water is boiling for me to take shower and go take your steam, right? Because you might have COVID. So there are like a lot of questions, but the thing is that you need really high temperature, very high temperature to kill the virus from your area. But at least we can try to get the mucosa clear, the nose, the mouth, even if you get, because the virus gonna stay in your nostril for a couple of days. It replicates, then it goes down, the initial virus, right? Although the Delta virus is, Delta variant is kind of behaving a little differently. So it helps, definitely it's not going to kill the virus, but it might clear the mucosa from your nose to get the virus, which is there, out from your system. Yeah.
Good point. And how accurate are the over-the-counter COVID-19 tests? I believe Biomax is the name of the type.
Yeah. So there are different kind of tests. We need to see which one has the highest sensitivity and specificity. That means which test, if it is positive, it is real positive. If it is negative, it is real negative, right? So that's called the sensitivity and specificity. One test we do is an antigen test, rapid antigen test. So it is it is more than 70% sensitive. If we do a rapid test, it is positive. Patient has symptom, exposure history, it is positive. But it negative does not exclude the possibility. So the test that we are doing is the PCR nasal swab, PCR testing, the plasma chain reaction. So that takes a piece of the virus's DNA. We can check it on the PCR technique. So it's a very good technology. Are we doing cultures? No, we are not doing cultures. Are we doing antibody tests like IgG and IgM? We could do it, but it's very expensive. So the quick, fast, and very sensitive is the PCR testing. And if you look into the test, it's an antigen test. It is not as good as the PCR. So in the hospital, in ER, we do the rapid antigen. If the rapid antigen is positive, patient has symptoms of COVID, this is COVID. If it is negative, we still do more testing. There's a physician. He passed away last year. When I saw him, he told me that I have COVID-19. I have 9 tests negative, but I know I have COVID-19. He's a private practitioner. He was a private practitioner. So he has like so many tests, all came back negative. Then the pulmonary doctor did a deep testing, like a bronchial wash. That came back positive for COVID-19. So this is how it is. We can miss it, but yeah, overtly we're using PCR testing. It's a very good test.
Mhm. And so Nicola has another wonderful question here where she says, we were advised last year that COVID-19 is airborne and that even outside we had to wear a mask, but now that is not so. How come?
Okay, so first of all, we have to understand what is droplet, what is airborne. So what are the airborne diseases? You know that, right? Measles, tuberculosis, these are the diseases that airborne. So airborne means when I cough, that secretion, that the droplet, it's gonna be so tiny, it just go and it goes far away and it float in the air for hours. So if you're in the room talking to somebody with tuberculosis or measles, you will get it if you talk to the person in the room. So airborne, it floats with a small particle in the air. That's why it floats. But right now, the data showing this is droplet, because the droplet, you cough and it's heavy. So the particle drop in the floor, right? It's not in the air for hours. Yes, if we sneeze very hard, our secretion with the COVID-19 patient could go even 25 feet, right? So that is situational, that is airborne. So this was a big talk. Like, you know, when I started, my group, we have 6 ID doctors. We're all telling this is behaving like airborne. Hospital saying this is not airborne. We don't have any data yet. Then they did some study in China and they used this light and they saw in the patient's room the laser light, and they saw that it was floating in the air for hours. So then they realized, no, the patient was coughing so hard that the droplet was like, you know, particle was getting smaller, and it was floating. But up until now, they're not declaring it is airborne yet, but it can behave like airborne in certain situations that I just mentioned. But personally, I still believe I believe that it is of course borderline. It is like airborne behavior. Otherwise, how come it's getting so rapidly community spread, right? Just like tuberculosis is spread, you don't know how you got exposed from somebody, and because it is in the air and you inhale. So yeah, it is a big talk. It is a big talk. And I have done a lot of reading on this topic because my heart was telling this is airborne. And all the data are coming, it is not airborne. But then finally China had that article that it shows that it was on the air for hours.
Mm-hmm. And Dr. Begum, what is your take?
Because this is my burning question in my mind, that they need to prove this is actually, you know, airborne.
Yeah, and you know, alluding to that more, do you think it is safe to go to restaurants and eat inside without the mask?
So right now, today, July 28th, I'll tell, because we are living in California, we have a huge fourth surge of Delta variant. If you go to a restaurant, just eat outdoor. Eat outdoor, not indoor, because indoor is more risky. This is like closed environment, the virus can float there and you can catch when you're eating, when you're opening the mask. But in the outdoor, it's like it's gonna just, you know, wash away on the way air. So there's less chances. So we have to, and you're vaccinated. So that's why it's important to vaccinate ourselves. We have that privilege, not like, unlike other countries in the world.
That is so true. The PCR test costs $175. Why are the costs so high for these tests?
Well, because these tests are, the technology is very difficult. If you have seen how they do it, like antigen test is very simple. It's like a strip, like a pregnancy test, right? So it's very cheap, even $20. Some places they offered even free testing. But the PCR is a high technology. It takes a lot of time and lab technician to do it. You know, all the laboratory in California, the laboratory technicians, they did not have enough technician to run this test because it's time consuming. It need manpower, hours, laboratory setup, and the machine, right? So it is expensive. Antigen test, like the rapid antigen test, it's just like a little strip. You can just do it yourself, right? So that's why it's cheap.
Mm-hmm. And then there is also a suggestion about your take on taking steam a few times a day using lavender or Epsom salt steam. Have you heard of that type of home remedy?
Yeah, I mean, there are all kinds of home remedies that on the, I have seen it, but lavender, I think if you really want to do some steam, it's just to clear your secretion. The basic science is there. It's not that the lavender is going to kill it, right? But it's because so that it's soothing, so that you feel good, the flavor, right? So you're like compliant on doing so. Whole idea is to, if you're out there working with a COVID patient or went out, did not take a precaution, you think, or you're like an essential worker, right? The grocery store worker, they were hardly hit. So many outbreak because they are dealing with money, exchanging so many people. Lots of people, essential worker, were infected. So those are the people, when you come home, you just clear the secretion, the viruses, if it's attached to your area. So the lavender, yeah, not itself causing the virus death, but yes, it's just the flavor and clear the secretions. Yeah.
And Dr. Begum, a little more intense of a question, but what is your take on the mixing of vaccines? Nowadays, in especially places like Europe and Canada, we are hearing that more often, where, you know, two different types of brands have been mixed, like, you know, first dose, one type. We were just talking about that too before the session started. What is your take on that kind of, you know, I know it's still in the works in terms of research, but is it by any means dangerous when that happens, when you end up taking, like, you know, we're hearing Covishield being taken, or AstraZeneca, and then the second dose being Moderna or Pfizer or whatnot. So what is your take on that?
Yeah, if you look into the viruses, how they are made, none of them are like a live virus. They are little particle, DNA particle, messenger RNA virus, right? Vaccination, that platform was used to get this spike protein particle, messenger RNA, DNA particle went into the template through the vaccine, gotten into our body with a lipid jacket, because, you know, it's like a very fragile, it go into our cells and make our cells will produce the antibody. So same theory with the messenger RNA vaccines. Even Johnson & Johnson, they are like the adenovirus vector, right? So the science and the technology are similar. Now we are talking about life. Right now, if to save life, if you have to mismatch, they are saying, let's do it. Even Indonesia, Malaysia, I heard they are also mismatching. India probably is going to do so, besides the Western country, because right now we are talking about life of a person. They are thinking, if I give at least one vaccine, get the antibody production, get the defense, and if I don't have Moderna, Pfizer, I give Johnson or other AstraZeneca. Yeah, they are doing it. Initially, you know, knowledge is power, and we are learning. The huge knowledge gap is still we are learning. This is pandemic. This is how it is. You know, in our lifetime, we're not going to see another one like this. Hopefully, inshallah. So basically, yes, to save life, they are doing it, and I agree with that.
Mm-hmm.
And science will support, because these technologies are kind of similar. Even if you look into the ingredients, not much change of those salt and the sucrose, I know that's in the ingredients, and it's not a live virus. So understanding the basic theory of how it is made, I think it will work, and we'll know more when we get this mismatch vaccine and check their IgG level. If it is good, then we know it's going to work quite well.
Mm-hmm. And then another question that has come up is, do you think it's advisable to wear plastic gloves while shopping, because lots of people touch items in stores? So, I mean, another question would be, what would be the right thing to do is when our seniors, our Olivers are going out and about, now that things are opening up, like, what is the proper precautions you think they should be taking in terms of what they can prevent and keep themselves safe?
Yeah, you know, this is very good question, because this is what we are facing every day, right? Right after this meeting, maybe we'll go for some grocery, right? So it's a practical question.
Right.
I love this question because this is very practical. The other day I was in a store and I saw a lady with the gloves. So I didn't want to give her a lecture because that's not right. She might get mad, right? So the thing is that the public health measures definitely say that wash your hand when you're going to the grocery. If you use the gloves and you touching everything, basically there is a way that you can transmit more viruses. So rather, don't use that gloves, wash your hand, do your grocery, and then wash your hand again. A lot of stores have their wall-mounted hand sanitizer, I have seen. Or what I do, I carry my own hand sanitizer, and I carry the, the wash clothes. You can do that. When you take the trolley, you can just wash it, do it, and hand washing before you touch your face, because touching face, that's how we transmit the virus from that cart or from the store boxes and to our face, and then the virus goes in. So it is discouraged. In our hospital, we have seen some of the physicians initially were rounding in such, then there was like a huge discussion and educational letters that don't do that, because you can transmit not in COVID, other virus, other bacteria too in such. Because you think it's like a false sense of protecting myself, but you might causing harm to other more.
Right. And you see that different companies, different establishments, grocery stores, or any type of stores have different protocols, right? So if there's a store that is not mandating masks, maybe, you can go to another business that, you feel comfortable. So again, do what is your own comfort level. I think that is also important. Sometimes we feel like, oh, we have to go. There are different grocery stores. So if certain neighborhoods don't mandate it, then go to another one that is, so that you feel safer shopping there. So
we are living in LA and 4 million people unvaccinated. So let these people get vaccinated. Vaccination is very easy now. There is vaccine.gov. You can go and find a local place where you can go. And they are giving like incentives too. You get the vaccine, they'll give you $100 or some gift card.
Oh, wow.
Yeah.
Too late for that one.
Yeah, so one of the doctors said that he took three of his patients himself to CVS, and the CVS technician was giving him a gift card. He said, "No, give it to my patient."
Oh, wow.
Okay. Such a great doctor. You did yourself. I say, yeah, they are my patient for many years. I took them, and so they got the gift card too. So California is doing that. So take advantage of it, get vaccinated, get the incentives, and protect yourself and your community.
And I am hearing over also is that it has to be income based too. Sometimes those incentives, if you are low income, those incentives come your way. There's another very good question is it appropriate to ask somebody visiting you or in offices if they are vaccinated? Like, will they be offended? Is it an inappropriate question?
Oh, so I didn't understand the question. Can you repeat?
Can you ask somebody who is visiting you or, in your workplace, are you vaccinated? Is it inappropriate or it's a okay question to ask?
Yeah, I mean, you cannot decline someone, especially in my office. So all these months I did telemedicine to see my patients to keep it going, right? But now I open up, I'm seeing patients. So what my MAs are doing is this is like a routine questionnaires. Have you gotten vaccination? So we cannot decline if they are not. So there's an opportunity that we can talk to them and make them understand the importance of it.
Yeah, that's true. You brought up a good point. I remember filling those up, especially for my dental visits. Like they make sure before I come in, I fill up a questionnaire. I wonder what they do if you say no, like if you're not vaccinated, do they deny service or not? I'm curious now.
Yeah, I mean, I think we have to be a little bit cautious about declining, not to see them. So our office, yeah, we talk about it because we wanted to make sure, but I think the governor said that the healthcare places, everyone they're going to make it mandate.
That was interesting.
Because some of our even ICU nurses are hesitant. Somebody say, oh, I had cancer, my immune system is down, but they are the one need the vaccine more. We have three, when I practice one of the campuses, we have 3 pregnant ladies now with COVID-19 hospitalized. They did not get the vaccine. So, when, and the doctors are seeing them, right? Pregnancy visits, they're unvaccinated, they have to see their patient. And they say USA, CDC, like in Europe, they said, if you're pregnant, no, you don't get the vaccine. In America, the guideline is this, you talk to your OBGYN and your physician, have a conversation because you are the high risk group. If you get COVID, you might get the full disease.
That's true. Well, I mean, we're closer to our ending time, and I think this was an amazing session where we really not only learned a lot, but were able to openly ask questions. So thank you for taking so many questions, Dr. Begum. I'm going to voice what Nicola said again. I think it's time the whole world prays to God that everyone gets vaccinated.
Dana, may I have a second?
We'll get rid of this horrible virus. 1 second. Yes, let me just make sure I have covered all the questions. I see a message in the bottom, but go ahead, go ahead, Rabina Auntie.
Dr. Begum, thank you so much. I'm one of the board members and president of Olive Community Services, and I really want to thank you from the bottom of our heart.
I appreciate what you're doing. Yes, wonderful job there. Yeah,
it's really amazing. And I've been off camera because I've been multitasking in my kitchen, but I did want to say salam to you. But I had an experience yesterday where I had a painter who's been painting my house outside. And then I asked him to do a little touch up inside, very nice guy. And I walked in, I said, we're supposed to be wearing masks. I didn't say you, I said we. So I put mine on it. And I said, you are vaccinated. He said, oh, no, ma'am. This was only yesterday. I said, what? Oh, my brother said I've done research. And I said, okay. So I let him be in far corner 5 minutes. I could not sort of come to terms with it. I said, you know what? I can live with my untidy paint, but please leave. Yeah. So I asked him to leave. So I think that message I want to share is that if people are coming into our homes to do services, that we can ask. And I experienced it yesterday. And in our offices, we're not allowed to ask. We're not allowed to ask. But thank you so much. I heard you, I think, in one other presentation somewhere else. We really appreciate the work you're doing. And
thank you so much.
Thank you so much.
And I'd like to thank Janab also to invite me to this wonderful ladies group, because I feel like we are one unity here. And yes, I love what you're doing. This is a great job. I did not know about this community service like Olive group. So I really enjoyed talking to all of you and meeting all of you.
Well, we are extremely honored to have you as our guest, and it is a pleasure to see wonderful leaders like you, representing such an important, especially an infectious disease expert, having people like you around us and advising us on all these amazing technologies and this huge learning curve that we're experiencing with the pandemic. Thank you for keeping us safe, for the work you do and all the services you have provided already to so many patients. Thank you.
Thank you. Thank you. Stay safe.
Thank you.
Yes, stay safe. That's the best thing we can do.
Thank you very much.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.